All right, I'm here with Colonel Jackson. He's on his 4th command. He is a licensed clinical social worker, and he is the team leader at one of the VA's programs for behavioral health. Colonel Jackson, how does Aquatics fit into behavioral and mental health?
You know, when I think about utilizing the water and using like aquatics as a tool for combating PTSD, I like it because it brings in the sensory integration issue. Also brings in the social form in terms of how can we integrate folks that are coming back with readjustment challenges. How can we use different treatment modalities in order to leverage whatever we can experiential-wise to bring that person to a new normal. So a lot of times I'll be speaking with my veterans, and I'm seeing a lot of gains with massage therapy. I'm seeing a lot of gains with aquatic therapy. And the different gains that I'm seeing is the social aspects, the hypervigilance is reduced, and this is coming from their self-report. So a lot of the feedback that I'm getting is that they feel more engaged with society, the social aspects. They feel more engaged with themselves. A lot of times veterans primarily have a hard time redefining themselves. So when I say finding the new normal, what I'm speaking to is finding the new normal post-combat exposure, post your allegiance to the largest and oldest fraternity, being part of the armed forces. So what we do is we use anything and all available assets in the community to get them to a new stated normal. And using aquatics is an excellent way to go ahead and leverage that piece of themselves that they have a real difficulty with. And I would say like the social interaction, the aspects of getting out there and saying, hey, I'm going to stay determined. Besides the gym, I'm going to go into the pool. This is a great, and giving themselves the leadway to say this is acceptable and this is not a disorder. A lot of times people look at this as being damning and being limiting, but it's really an opportunity. So when we were speaking earlier, I have found just through my anecdotal research, I found that a lot of our veterans benefit when we go to a non-traditional stance in terms of our treatment modalities. So utilizing massage, utilizing transcendental meditation, utilizing these different things in chorus with each other. Transcendental meditation in the water, using the massage aspects of that. Also using the social forum in order to get them, from getting too involved in social isolation, getting back into the trust forum that we want them to be part of, and engaging life on their grounds, engaging life in a way that they feel like they can be productive and be skilled.
And speaking of productive and skilled, the veterans who suffer with pain and go and get rid of their pain doing aquatic therapy, how does that impact their mindset?
Well, you got to think about the second and third order effect. So primarily just getting them there, getting past the social phobia is huge. Once we get them there and they start seeing the benefits of the aquatic therapy, it's at that point that they start developing the internal dialogue. This is helping me. This is improving me. So their self-concept improves. So we start combating the secondary causes of depression. Now we're releasing dopamine and norepinephrine and epinephrine and serotonin. All these chemicals are coming full circle because now we're engaging them in an environment, a teachable environment, where they can make gains. But it's not whether we see that they're making gains. It's when they see that they're making gains.
All right. Well, thank you.
Thank you.